Hi, Senator. My name's Arlinda, and I'm thanking you in advance for taking time to listen to this brief on the Safe Staffing Act, Senate Bill 514. Just to refamiliarize you with the bill, this bill is a Safe Staffing Act so that nurses have nurse appropriated staffing ratios to take care of patients in a safe manner. The staffing levels will be comprised by a committee that's appointed by the hospital, and it'll be 75 to 80% direct care nurses that will be coming up with the numbers for the staffing levels. The staffing levels will include ancillary staff as well as RNs, and it'll be based on the acuity of the patient and the patient's specific needs to the unit. The bill will also require hospitals to be transparent in reporting their compliance with the ratios that have been come up with the committee, and as well as reporting when there's non-compliance to the ratios that have been established. They will also have to be monitored by AHRQ and NDMQI and other appropriate agencies that are mandated by the hospital. There's also a component that allows for the right to refuse an assignment. If a nurse does not feel safe in her assignment, she can report that to her charge nurse so it can be reassigned or reconfigured to the patient's acuity level. And the nurse is also protected by the whistleblower protection clause that's incorporated in the Act. Just a little background on safe staffing. The research has shown that patient safety and safe staffing levels are directly related as far as adverse events and mortality, as well as nurse burnout and fatigue. So that directly reflects the nurse's intent to stay with the organization. The financial incentives to the hospital, it's been shown that overtime has increased during the past year, with 43% of all RNs working overtime to fulfill the needs of the staffing for the hospital, and that as well contributes to their stress level, and it impacts their job satisfaction, and it has many nurses leaving the bedside. Along with costs, the average hospital is estimated to lose about $300,000 per year to replace each nurse that leaves the field. By adding these RNs to the bedside to reach our safe staffing levels, the RNs will generate over $60,000 annually in reduced costs in patient adverse events and mortality and hospital stays. So, in conclusion, safe staffing is a healthcare issue, and it's a public issue. People are concerned with the fact that they want to know how many patients each RN is taking care of, and if that's a safe staffing ratio to be able to meet the needs of the patient and to meet their outcomes. And New Mexico needs to be at the forefront of this initiative to be able to improve healthcare across the nation. Did you have any questions for me?
The nurses email a representative?
Oh yes, that's my plan, to be able to move this initiative forward, is to have the nurses at my hospital, as well as to comparing to the other local hospitals, to have their nurses to email their representatives. And as we move this forward, I'll continue to follow up with you to see how this bill moves through the House and the Senate. Thank you again for your time and cooperation with this brief, and I hope to hear from you soon.